So the topic is USMLE study partner. First of all, thank you so much for subscribing my channel and really grateful to have 18 subscribers till now and having such immense views 53 on my YouTube channel. It means a lot. And previously 164 views. It also means a lot for me. Thank you for believing in my content and watching my YouTube channel. Now, let's continue our topic. See, USMLE is a very long journey. Okay, so we need USMLE study partners, and you can find that partners anywhere on Telegram or on Reddit or on Discord or Facebook. Even you can make or you can find USMLE study partner group on WhatsApp as well. So why this video I am creating? First of all, please try to understand that USMLE is not just about resources. It's about consistency, and I have discussed it earlier in my previous video as well. And consistency that becomes easier when you have the right study partner. And USMLE is a long journey, as I told. So, studying alone can lead to inconsistency and burnout. And to save ourselves from inconsistency and burnout, a focused study partner can help us. And they can help, he or she can help discipline, clarity, and accountability management. So obviously a focused study partner is meant to improve discipline, clarity, and accountability. So who should we connect? See, we can connect any USMLE step 1 or step 2 aspirants. Okay, we can also connect beginner or early preparation phase students. We can also connect concept focused learners, and we can also connect long term consistent mindset. Okay, how should we study after connecting with the study partner? See, first of all, we will have to study individually. Okay, then we can have short discussion sessions. I'll discuss it in detail in later. And also, we should have concept clarification. Also, we should analyze our weak area and so that we can revise. And most importantly, we should study with the accountability. What should be the time commitment? See, we can have study sessions of 30 minutes or 45 minutes or 60 minutes. Okay, we can do it daily or on alternate days basis. Okay, and most importantly, whatever we do, do it daily or on alternate days, doesn't matter, but there should be fixed timing. Okay, that is preferable. Okay, so what could be the expectations from a study partner? See, the study partner should be serious and consistent, and that he or she should be respectful of time. He or she should be honest, should have honest communication, and you should not do comparison or you should not involve in any type of competition. Okay, so these expectations from a study partner are genuine. What could be the boundaries? See, study partners means it doesn't mean sharing everything. Okay, and also boundaries should be defined, like no reading together. Okay, no rushing, and exit politely if mismatch. That's it. Okay, so if you are interested, comment below or contact via descriptions given in my description box. Okay, so if this approach resonates with you and you are preparing for the USMLE, feel free to comment below or reach out through the contact details in the descriptions. There could be some red flags behavior in a study partner, so we should avoid. Okay, what could be the red flags in a study partner? Like one may cancel frequently, or who comes unprepared, or who talks more than studies, okay, and who competes instead of collaborates. Study partners means collaboration, it doesn't means having competition. Okay, the most important red flag behavior in a study partner could be excessive you world discussion. No, only essential discussion on you world should be done. Okay, and see, a study partner, you are making a study partner, you are connecting with them, so there should be some agreement rules. Okay, there should not be any kind of personal talk. Don't be so much personal with this study partner. Okay, that's very important, otherwise you may ruin your communication. Okay, and secondly, no shaming over low scores. Like we will share our scores. Okay, so if we are sharing our scores, maybe is high, maybe sometimes low. If it is low, no shaming over low scores. Okay, and that should be also an agreement. Okay, also there should not be any superiority tone as well. Okay, so there should be no inferiority tone as well. Okay, so the person should not have a disorder of superiority inferiority complex. Okay, and lastly, there should be honesty in discussion and communication more than ego. Okay, if study partner has ego, that should be disagreed. Okay, now remember, USMLE preparation requires patience and consistency. The right study partner can make this journey more structured and sustainable. So, what could be the session framework for a USMLE study partner? See, I have designed six things under session framework, which should be at least for 60 to 70 minutes. Okay. Now, there should be rapid check-in for 5 minutes. There should be U-World high yield review for 30 to 40 minutes. There should be first aid or notes integration like for 10 to 15 minutes merely, and then there should be rapid fire USMLE questions as well for 10 minutes, and there should be log tomorrow's target for 5 minutes. Okay, and the last one is one line reflection. I'll discuss all these six things in detail. See, in rapid check-in, what we can do? Can you guess? See, in rapid check-in, it is about accountability. It is about accountability rather than storytelling. Okay, so it is about accountability. Accountability. Okay, what should we avoid? We should avoid storytelling in rapid check-in. Okay, so what could be the point in rapid check-in? That in rapid check-in, ask the yesterday's target. Okay, yesterday's target. Okay, whether it is done or it is partial or it is missed. Okay, so that should be checked in a rapid check-in. Okay, also we can ask, what is your U world score? Okay, in percentage we can ask. Lastly, we can ask 1 week area noticed, so that we can discuss about it. 1 week area notice. Okay, so the point is, try to understand lastly how the rapid fire in like just few minutes we finalized. You can say that I have practiced 40 questions from Yuval. Okay, and my score is something something. Okay, percentage you can say. Okay, and lastly you can say that I have found my weakness in a topic. Okay, in a topic, for example, renal tubular acidosis. Renal tubular acidosis. So these things should be done in a rapid check-in and should be done within 5 minutes. Okay, how much question you have practiced, how much score you have secured, and what is your weakness, any topic. Okay, now coming to second part of our study partner session is Uwald high yield review, and it should be done for half an hour, 30 or 40 minutes. So what we can do within this review, see, we will discuss only incorrect questions, only incorrect question. Okay, also we can discuss marked question as well. Okay, secondly, I would say what could be the format of discussion. See, certainly there would be any diagnosis you have done. Okay, so while you have diagnosed, okay, what was your concept? Okay, and what was the key clue line? Okay, in the question. Okay, and also why your answer is incorrect. Okay, and lastly, why correct option is right. Okay, so these things can be discussed. See, in why your answer is incorrect, it is also called as incorrect logic trap. Maybe you have applied any wrong logic, that's why your answer was incorrect. So that can be discussed. Okay, and all these should be discussed in exam oriented reasoning. Okay, so the point is that all these things should be done in exam oriented reasoning. Okay, so while discussing the wrong questions, we can discuss about the diagnosis, we can discuss the key clue line in the question, why your answer is incorrect, or why the correct option is right in exam oriented reasoning. Okay, so after doing all these things, you will come to the last point. If if there is if there is X, then think of Y. Right? You will conclude like that after discussion. If you are concluding that if the X is present in the question, then probably the diagnosis is Y, then you have completed your discussion. Now, come to the first aid or notes integration. While solving question, probably or surely you will have certain things from the question which you would like to aid or integrate in the first aid or in notes. So mostly we use first aid, right? So in first aid we can annotate as well. Okay, so what we'll do, at the same time immediately we will open first aid. Okay, and we will annotate the important points. Okay, we will add what we can add, any clarification. Okay, we can add clarification, and also we can add, what do we say, any mnemonic. Okay, we can add any association, any association as well. Are you getting my point? What do I mean by saying any association? For example, for example, if there is metabolic acidosis, metabolic acidosis plus hyperkalemia, hyperkalemia, okay, then you should think of diabetic ketoacidosis. Are you getting my point? Yes. So this is called association. So certain things you can add. Now coming to the rapid fire USMLE questions. It will help you enjoy the discussion as well. See, ask any short USMLE style question. Okay, ask any USMLE style question from your study partner, and it should be exchanged. Okay, one should be asked by your study partner and your second question should be asked, by yourself. Okay, so what could be the rule? It's a it's a thing I would like to discuss. Rule is very important in rapid fire. What should be the rule? If you are asking any short USMLE style question, so the rule should be no long explanation, okay, and maximum 15 to 20 seconds should be given for answer, okay, per answer. If it is correct, move to the next question, and if it is incorrect, okay, then give only one line correction. Okay, so like you are asking, what is the drug of choice for acute gout? It can be a question from your study partner. Okay, your study partner may ask, what is the next step in any unstable patient? Okay, and after that you can ask any question like mechanism of action of any drug. Okay, so that will help you in a rapid fire. So the rule is, if you are asking any short question, there should be no long explanation. There should be given only maximum 15 to 20 seconds for one answer. Okay, if it is correct, move on. If it is incorrect, give one line explanation. I hope you understand. Now If it is over, rapid fire is over, then block tomorrow's targets and discuss it only for 5 minutes. Okay, what you can discuss? You can discuss the topic or system to be studied. Okay, you can discuss how many questions you will practice tomorrow. Okay, and lastly, you can also discuss resources to be focused on. Okay, you can discuss all these things. So tomorrow's target should be locked, and that will help you for the continuation of the session. Okay, so decide any topic, number of questions, and then the resources to be studied. It's very important. Now, the last one is one line reflection, and it is very interesting. Like everyone should give a kind of reflection. What should be the reflection? The reflection should be like that: one thing I have learned today. You know, you probably would have anything learned. Okay, one thing I learned. Okay, you can say like, okay, one thing I need to improve. You would realize after discussion, right? So these things will be your reflections. Okay, it should be done only for 30 seconds. That one thing I learned, one thing I need to improve, and something like that. Okay, if it is done, disconnect. No overtalk, please. Remember that a good study partner increases consistency and thinking quality, not your IQ. Just a joke, but to be taken seriously. So, to inform you all that we have in one of the Government Medical College a WhatsApp group, USMLE Study Partners. Okay, so we are there studying together. For all those students who are interested in USMLE, they are in a separate unofficial USMLE study partner groups, and therein we follow all these six things. What are those six things I have discussed right now? So we discuss the rapid check-in, we discuss UWorld high review, first aid and notes integration, rapid fire USMLE question. We lock tomorrow's targets, and we also give one-line reflections, and that makes the group discussions interesting. Okay, so thank you so much. Like, share, and please subscribe. Feel free to subscribe if it helps you. Thank you so much once again. Have a nice day.